Welcome to the County Compass, Columbia County's guide to news, voices, and perspectives, hosted by County Manager Scott Johnson. This podcast is your behind-the-scenes look at what's happening in county government and across our community. We'll talk about the services, projects, and decisions that make Columbia County a great place to live. We're glad you're here. Thanks for listening to the County Compass. Now, here's Scott Johnson.
Hello, everyone, and welcome to the County Compass, the podcast that keeps you connected to the people, projects, and progress making Columbia County one of the best places to live, work, and raise a family in Georgia. I'm your host, Scott Johnson, the County Manager here in Columbia County, and thank you for joining us this week and on previous episodes. And this week, we're going to be talking about a very, very exciting project that has been over a decade in the making. And we're getting very close to the end of that project, and we're going to talk about why it took so long. But after years of vision and planning and persistence and partnerships, the Wellstar Columbia County Medical Center is about 90 days from opening its doors. I had the opportunity to tour the facility recently and just have a lot of things to unpack to tell you about this amazing hospital that we're going to have here in Columbia County. I will say that it's not just another building. This is a game changer for our community, for healthcare access, for economic growth, quality of life for our residents that we talk about so much and is so important to us. All of that is part of this. Today we're going to walk through the full story. I'm going to give you the background, how we got here, talk about some of the challenges that we met. How did we end up with Wellstar and Augusta University as our partner? We'll talk about that. We're going to talk about the RFP process that we issued and how we went through that, complexities of certificate of need laws, which some of you may not have even heard of that. So we'll break that down for you and let you know. And then really ending up with that powerful partnership with Augusta University and Wellstar. We are so excited to bring cutting edge technology to Columbia County as it relates to healthcare. So let's go back to the beginning, and we'll talk about kind of how this process started. We all know Columbia County has really seen tremendous growth. We've talked about it before, double digits in every census since 1950. That's a long time of people coming to the community and our community growing. And I know there are some that'll say, is enough's enough. But again, when you live in a world-class community that works so hard to provide the quality of life at the levels that we do, people want to be a part of that. So we've seen that growth. And one of the things that we realized that we were missing as we were, thinking about how do we build Columbia County out and what do we really need as it relates to the government, local government strategy. We don't bring retail and stuff like that. We can go out and try to recruit it, but what were we missing? And I'm not talking about a gas station on this corner or a grocery store over here. What we were missing was access to health care, and high quality health care that was close to home. We are blessed to live in the Augusta region, and Augusta is well known for its medical community. We have several very well-run, well-known hospitals. We have the Medical College of Georgia right here in our area, and it produces, again, world-class doctors and other people in the medical field, nurses and pharmacists and dentists. I can go on and on and on. MCG is just known for producing these great healthcare providers. But Columbia County itself didn't have a hospital, and we had to go to Augusta, and that's fine. I mean, we're close enough to be able to do that. But think about it. If it's an emergency, then definitely we have traffic issues, and we're trying to get people, and you got to get downtown, and it's maybe 20 miles from where you are, and time is of the essence in an emergency situation. But even when you think about convenience, think about going for a routine procedure or just a surgery that you have to have or anything like that. It's a little bit of a challenge. So that's when I took over as county manager. One of the things that I really wanted to do was to what I would consider fast forward this process, but really what I learned was it was just really getting this process started because it was going to be so long. So this goes all the way back to 2010, 2011. We were working on this project, working on the vision of getting a hospital in Columbia County. So we actually issued a request for proposals. Now, why does Columbia County do this? Why is Columbia County even involved in this? Well, we're going to talk specifically about the CON process, and that's certificate of need process in Georgia. And you have to have a certificate of need, or you had to have a certificate of need to be able to get a hospital in your community. But there were a couple of ways that we could get around that. And one of the ways that we could do that was what was called a sole community provider. So certificate of need, which again, I'll break down for you in just a second about the whys, but let's talk about the sole community provider first. What that gave Columbia County was really an entry point into being able to get a hospital as a community. So instead of the hospital going to the state Department of Health and saying, hey, we want to open a hospital in Columbia County, it was the community reaching out and saying, hey, we need a hospital in our community, and we understand that there's a mechanism by which we can do this called sole community provider. And what that meant was we could work with a hospital, get them to come here, but then we would be responsible for 30% of the cost of that hospital. Now, that was a big thing, obviously, for us to be able to come up with 30% of a hospital. And then there was a question about, well, do you own that? Do you own your 30%? How do you do that? And so it became a real challenge for us to be able to do that. But we knew that the only way to get a hospital when we were trying to do it back in 2010, 2011 was as a sole community provider. So we issued the RFP. And we had several responses back, and we made the hospitals come in and give presentations. We put a citizen committee together, along with some elected officials and some staff, to review those RFPs to determine who was the best one to actually provide the service for Columbia County. Now, let me just go ahead and say that everybody that submitted an RFP, it was a lot of the local hospitals we're all familiar with. Everybody that submitted an RFP, I think, submitted a really good one. That responded to that request for proposal. They were all good, and I think any of them probably could have done the job. But at the end of the day, Augusta University, at the time I believe it might have been Georgia Regents Medical Center, still part of MCG in the Medical College of Georgia, they were the ones that actually won or got the RFP. So that started another process, and it started a series of challenges and lawsuits and some other things because, obviously the other parties wanted to be involved in this process. But Augusta University, we're going to call them that. That's what they are today. They came out on top, and they started working through the process of building a hospital here in Columbia County. As we moved through that process, Augusta University ended up choosing Wellstar as an operating partner, and we couldn't be more pleased with that here in Columbia County. We have very, very strong relationships with Augusta University. I think a lot of their senior staff. President Keene is doing an outstanding job leading that organization from the university side. But it's so complex with the hospital piece of it in the Medical College of Georgia. They have an amazing team down there doing great things. But choosing Wellstar to be their operating partner was really a game changer for us too, because Wellstar just brings such a wealth of knowledge and experience to our market, and they are just very, very, very good at providing world-class healthcare services. I'm blessed to have been able to meet some of the folks that will be running that operation out there. Dr. Ralph Turner is the CEO of the Columbia County Wellstar Hospital. Nathan So is the chief operating officer. Had opportunity to meet their chief nursing officer, Tammy, yesterday or earlier, late last week. But anyway, great team all the way around there at Wellstar. So we're super excited about them being our partner moving forward. So let's talk a little bit about the certificate of need and why the sole community provider. So it was put in place like in 1979 to protect, I guess, the state and local communities and even the hospitals against competition. And basically what it does, it requires state approval through the Department of Community Health for any new or expanded healthcare facilities and for certain services that they have. And the original goal was to control cost and prevent unnecessary duplication of services and ensure access to healthcare especially in the underserved or unserved areas. So there was a need for that certificate of need that was put in place in 1979. But when we were doing our project, again, back in 2010, 2011, into 2012, the CON was a significant hurdle for us because there was no guarantee that even if we provided the need that we would get state approval for this hospital here, and that's where some of the legal challenges that I mentioned earlier kind of came in. Where there were people that were saying, no, you don't need a hospital there. You're close enough to Augusta, or no, this is going to drive up costs, or this is going to be a problem this way or that way. Excuse me. So whatever. We worked through that process, and there we had to show the community need. And again, our partner that we had chosen at the time, Augusta University, had to show financial feasibility. They had to address the impacts on the other providers around. And then after everything was said and done, we were able to work our way through that 2015, a little bit after that. So ultimately, we were able to get that certificate of need from the Department of Community Health, and that allowed us to move forward with the project. So I want to talk a little bit about the money piece of this, because remember I said that to get a sole community provider, we had to put in 30%. So for the county to be able to do that, and we're talking about a $100 million project at the time. It's actually grown since then. But at the time, it was a $100 million project. So for us, for easy math, it was a $30 million commitment from Columbia County. We had to come up with our piece, and that was the only way that we could meet the sole community provider, definition to be able to even have our hospital. So we went to the voters and we put it on our last SPLOST, and we said, hey, we want to ask you, the voters, if you want a hospital in our community, and if so, we're going to have to pony up $30 million. But we were smart about that because we knew that either A, CON laws could change, or B, there may be a way that we could put our piece into infrastructure and maybe get paid back for that. So to kind of make a long story short, what ultimately happened was when Wellstar came on and Augusta University came on, they basically said, hey, look, we only need your $30 million or your 30% because the law says that we have to have that. If there's a way that we can pay that back over time, or you could issue the bonds on our behalf, because Columbia County has a AAA credit rating, which we were able to work with our hospital authority, newly created hospital authority, to do that, to issue those bonds for them. They said, we'll pay it all back 100%. We don't need your $30 million, which was great for us because it freed up $30 million. Now, the problem is we had the voters vote on that. And when the voters vote on a project and they vote on an amount of money through a SPLOST program, then that's what it has to be used for. And if it's not used for that, it has to go back to the voters to be reassigned. Luckily, we had the foresight, we had the working knowledge, and this is where having an experienced team running your county government really comes into play and really helps. We were able to have contingency projects on the ballot. So you, the voters in Columbia County, you voted for the hospital and you voted for the $30 million to be allocated to that hospital. But what you also did is you voted on a list of what we call contingency projects. So should the hospital not happen, or should we not need the $30 million, then we would do these following projects instead. So we were able to do that. We got that through. It's very legal. So I'm very glad to report that we've not had to use any of the money on the hospital, or give any of the money to the hospital. They are doing very well, and I'll talk more about the hospital here in just a second. But we were able to free up $30 million of additional SPLOST money to go to the contingency projects that were defined by the voters, and then be able to do more projects in Columbia County. So it was a win-win all the way around. I just wanted to make sure that I kind of explain that to everybody, and so they know that we're not on the hook for that. The county's not on the hook for any cost of the hospital now. We're not on the hook for indigent care. We're not on the hook for anything. Our hospital authority issued the bonds and has a seat at the table. But outside of that, we just worked together with a partner and brought an amazing facility here to Columbia County. So kind of fast forward a little bit to kind of finish up on the CON thing. I know that may get boring for you, but I want to just make sure everybody understands that in recent years, including some significant updates in 2024, the House bill, I believe, was 1339. They changed a lot of things in the CON, removed certain capital expenditure thresholds. They added some exemptions for rural and teaching hospitals, streamlined the process, but maintained that core oversight. So our project navigated the system well under the rules that were in place at each stage, which ultimately led to the hospital being in place now. And while that CON process seems lengthy, it really helped shape a project that's truly responsive to our needs in Columbia County. If we were to do it today, it would be a little bit easier to do today. But hey, we got through it, and the hospital's there, and that's really what matters. Speaking of partnerships, I did want to say that major leap forward between Wellstar and Augusta University was huge. They did that in 2023, creating Wellstar MCG Health. So this alliance is now going to combine academic medicine excellence from Augusta University and Wellstar's extensive operational experience across Georgia to be able to operate this hospital. So what does it mean for Columbia County? It means our hospital will benefit from top-tier leadership, research integration, medical education opportunities, and a broader network of specialized care. This hospital is going to be like none other you've ever seen. I'm so glad to be able to sit here and tell you that. And sometimes I feel like we're bragging about what we're doing in Columbia County, but we're so excited and we're so proud of what we've been able to accomplish, either ourselves or through our partners. It's just a win-win situation for the county, for patients, for the next generation of healthcare professionals, for everybody involved. So just super excited about that. Let's talk about the hospital itself, though. I think that's important, and that's what a lot of you want to know. You've probably ridden by and you've seen that. It's located at 5000 Gateway Boulevard outside of Grovetown. So it's right on the interstate near the Walmart, the Exhibition Center there at I-20 and Lewiston Road. It's a 6-story, approximately 254,000 square foot facility on 22 acres that were purchased by Augusta University. There is room for future expansion there. There is also a 92,000 square foot medical office building right next door that's being finished up now. So what does the hospital have? 100 beds, 100-bed hospital, meaning that the rooms can flex from medical, surgical to ICU level care as the patient needs change. So what's really cool about this is, and I think what we learned during COVID, what the medical, excuse me, what the medical community learned during COVID was not every room was set up to be like an ICU room, and we were running out of rooms for COVID patients. So what they've done at this hospital is they've set up every room to be able to manage at the highest level, and then if we need to manage at a lower level, we can do that. Now, obviously, that was a significant expense, but it was one that they were willing to do to be one of the most technologically advanced hospitals and prepared hospitals anywhere, and we have it right here in Columbia County. Some of the key services that we have there: 17-bay emergency department and critical care, level 2 trauma when they open, which is super exciting for us. I think it's going to mean much safer community for us and give us a better chance if you're hurt in an accident somewhere. They have 6 operating rooms, interventional radiology, and cardiac cath labs, inpatient and outpatient imaging there. They have endoscopy suites, pharmacy services for both the hospital and the public, and much more. I mean, this is when I was really blown away. It's the first time I've been in the hospital since really I went for the groundbreaking, and then I think I visited maybe once or twice during construction, and this has been over the last couple of years. But to see it today is just really amazing what they've done. What makes it so technologically advanced? This is where the hospital really shines, and something that we as Columbia County had in our hearts in the very beginning. Excuse me. Every patient room will have high-resolution cameras and touchscreen monitors for telehealth and virtual care. They replaced the traditional whiteboards that you see with new technology there. It gives you the ability to do real-time consultations with specialists, better family involvement. The family knows more about what's going on. The design incorporates virtual and augmented reality tools during planning for optimal workflows. It's built for digital healthcare, which is something new, seamless electronic records, advanced imaging, and all the integration with the broader Wellstar MCG network. So think about a doctor downtown consulting with a doctor out in Columbia County in real time, which is really, really cool. And the patient rooms, I love this part. They're all private and they're all adaptable. So I think Augusta University and Wellstar heard from the public, look, when we go to the hospital and we're there, we don't want to share a room with somebody. And so many times that in the past you've had to do that and everybody's asking for the private room. The great thing about our hospital in Columbia County is all 100 rooms are the same. They're large, they're private, they're very technologically advanced. It's really the best of every scenario. So we're super excited about that. So it's not just a community hospital. It's not what we set out to be. It's a state-of-the-art facility bringing academic level technology right to our doorstep here in Columbia County. Construction has done well. I will give a shout out to Turner Construction. Did an amazing job on this project. Have really worked well with our staff and our inspectors and our chief building official. Again, just such a collaboration. I remember the groundbreaking when it first happened, and they were out there and they were ready to get going. And the governor was here, Governor Kemp was here, and we had a lot of dignitaries, a lot of people that had been involved in the process here in the very beginning. We knew that this was going to be something special for our community. But to everybody that had a part of that, I definitely appreciate that. And again, through the bonding process and coming up with the money, it was a true partnership. For recent updates, again, I was at the facility recently myself touring. They do have their CO, which is certificate of occupancy now. It's already been issued. So now they're bringing furniture in the building. And the plan is we are about, from the time you hear this the first time when we drop this, and we are now at the end of May, beginning of June, we're about 90 days away. So we're thinking that in August, mid-August to late August, the hospital will open, and we're excited about that. There will be an opportunity for the community to come out and look at it and check things out. But then they will be seeing their first patients as well. So hopefully you'll get to look at it as a community member in the open house and not be the first patient. But look, if you need to be, they'll be ready for you, which is great. When it opens, it's going to bring over 1,200 jobs to our area. These are all clinical support, administrative things. That's going to be a huge economic boost for us. Think about all the restaurants that are around there and the places to shop. When you got that many people coming in and out every single day, it just helps our economy. So it helps spur what we have going on here in Columbia County. It's also going to reduce the strain on regional emergency services and keep more healthcare dollars local. We have a very strong partnership with Gold Cross Ambulance Service in Columbia County, and they transport downtown to the hospitals down in Augusta right now. So think about the time that's going to be saved by an ambulance being based in Columbia County, picking up a patient in Columbia County, taking them to a hospital in Columbia County. That's quicker, more turnaround time. They can do that faster. They can get back out on the street, which means we need less ambulances, hopefully. Which saves us money. And at the end of the day, that's what we're trying to do. We're trying to be as efficient and effective as possible for the least amount of money. I know sometimes we get blamed for not doing that, but it's exactly what we're doing. So did want to give a couple of shout outs and thank some folks. Definitely the commissioners, Board of Commissioners in Columbia County. Without your vision and constant staying on top of this, it never would have gotten to where it is. Our hospital authority doing great, issuing the bonds. Everybody at the state that helped with what we've done here, all of our state partners have done great. Wellstar, MCG Health, now that the merge is there, definitely we are super excited about that. And then obviously I've already mentioned Dr. Russell Keene, the president of Augusta University, and his team, his executive level team. again, done amazing things to make this a reality for Columbia County, and they're continuing to expand really all over Georgia. But we are so glad that we have one of their crown jewels right here in Columbia County. So thank you, Dr. King, for your leadership and what you're doing at Augusta University. And I would be remiss if I did not mention one name. I want to mention the name of Jennifer Miller, my friend at Augusta University that has been there for quite some time, and she has worked with this project from the beginning. She was vice president of, I believe, strategic initiatives early on. I'm not sure what her title is today. I get to see Jennifer and her family quite often. They are good friends, but I want to give Jennifer a shout out because she was the person that started this project here in Columbia County. I believe she had a lot to do with writing the RFP and then guiding it through the process, and just did amazing work. So Jennifer, thank you for your contributions to Columbia County and for being such a great partner, a great employee, and somebody that really worked hard to give us what we need here in Columbia County. So as your county manager, I'll just say that I'm very proud of how far we've come here, from that initial RFP to getting through the CON, to trying to figure out how it's going to be paid, to setting up a hospital authority, to picking somebody and then them partnering with another world-class organization such as Wellstar. This reflects our commitment to proactive, responsible growth, and the fact that Columbia County is not willing to quit. When we see something we need for our community, we're going to work hard to get it, no matter what. Again, for our residents, it means a faster response, advanced care closer to home, better chronic disease management, and a peace of mind for families, and that's really what it's all about. So stay tuned for future episodes. Hopefully we can maybe get somebody in as we start taking guests. And I know I keep teasing that. We're getting ready we're almost to the point where we can start bringing in more guests to the podcast. But maybe we can get somebody from Wellstar or Augusta University to join us in the future. As promised, I want to go over hit on the most ridiculous thing I've heard lately. And I didn't hit on this last week, but I do want to hit on it this week. And this is the whole idea about our Boom in the Park celebration here in Columbia County and why we're doing what we're doing. It's a ticketed event this year. It's the first time we've ever done that. And I heard, this is the most ridiculous thing I heard, we are doing it to exclude members from our community. We're doing it to exclude our neighbors. We don't want people that don't live in Columbia County. Folks, that's ridiculous, and that's not true. Let me give you the background of this about why we did what we did and then what we're going to do going forward. What we did was a result of getting community feedback. So often we are accused of not listening to the community and not responding to the community. One of the things that we have heard repeatedly is some of our events are too crowded, and Columbia County residents can't enjoy the amenities in Columbia County as a result of us putting on great shows or great concerts or whatever the case may be. So we decided this time, we said, hey, we know what the capacity of the park is, and for Boom in the Park for 4th of July, we're going to issue tickets. So we have a good idea about how many people are going to be able to be inside the park. Now, this helps us with law enforcement. It helps us with the medical response. It helps us set up the park better. It helps us clean up the park. It helps the family experience. So knowing that if the park can comfortably hold 12 to 15,000 people, it becomes a challenge when you put 30 or 40,000 people there and you can't even move. And then, you have fights and you have other things. And folks, that don't have anything to do with where you're from. That's not we're not blaming anything bad on anybody outside of this community. And that's what the accusations are now is you think, people from other counties are coming in and causing, your people in Columbia County problems. That's not what we think. That's not the strategy behind this. The strategy behind this is listening to and responding to our residents who said, we want a better experience, so what can you do? So we said, we're going to issue tickets, and we're going to issue so many to each family, and we're going to start with Columbia County residents because it's a Columbia County event. So we put that information out. Immediately started getting opposition and started getting some people that were upset about the way we were doing that. It was never our intent to exclude anyone. From day one, we said we're going to allow a time period for Columbia County to get their tickets first, and then we're going to allow our neighbors from other communities to be able to get to get tickets. We're still going to do that. You're still going to be able to get tickets if you're in a neighboring community, if you want to come experience our event. When we get to the maximum number of tickets, whether you're a Columbia County resident or not, when we get to that maximum number, we're going to cut it off. And if you want to enjoy the show, you're going to have to do it outside the park, somewhere else. But we can only do what we can do. And this was a strategy just trying to respond to our community, trying to listen to your feedback, and trying to make a family fun, safe event for everybody to enjoy. It was not meant to exclude anyone. It was not meant to target anyone. It was not meant to hurt anyone's feelings in any way, shape, or form. And it was certainly not meant to strain our relationship with our neighbors. I will tell you that my friend Mayor Garnett Johnson reached out and said, hey, look, we are great partners and we love what you guys are doing in Columbia County, and we appreciate what you do for us in Richmond County here in Augusta, but really wish you would rethink the process. And when I explained to him that we were going to be opening it up to others, and really that was his request, just like, hey, look, I got a lot of residents that would enjoy the show. And I said, Mr. Mayor, we're going to do that. So thank you, Mayor Johnson, for your leadership in Augusta and reaching out to myself and the chairman. And then I've talked to people in other communities west of us as well. You're all going to be taken care of. We want you here in Columbia County. We are inclusive. We are about unity. We do want to unite our community. So we're trying something a little bit different this time. If it doesn't work, hey, we'll do it another way next time. Hopefully it will work. So just want to say, ridiculous that we're trying to exclude anybody from Columbia County. You're all welcome here, and we appreciate you being here and wanting to be a part of what we're doing in Columbia County. So with that, I'll say thank you for listening to this episode of the County Compass. If you have questions related to anything you've heard here today, you can always reach out to us. You can visit columbiacountyga.gov. You can put your comments down in the comment section here on the podcast. If you enjoyed it, I ask that you subscribe on Spotify, Apple Podcasts, or YouTube. Leave us a review. Leave us your comments. More importantly, thank you for tuning in and being an engaged part of Columbia County and our community. Your input and participation make our county stronger. So I'll ask you to stay safe, stay involved, and keep loving this county as much as I do. Take care.
This has been the County Compass, Columbia County's guide to news, voices, and perspectives. Thank you for listening. We appreciate you taking the time to stay informed about the issues, initiatives, and people impacting our community. And we sincerely hope today's conversation helps you better understand the work being done in Columbia County. Be sure to subscribe so you don't miss future episodes. As always, visit Columbia County's official website or social media channels for additional information. And until next time, thanks for tuning in.